Canada's health minister says she won't stand in the way of a generic version of OxyContin, the powerful painkiller that's often abused by addicts. But Health Canada will add new rules aimed at reducing the abuse of OxyContin. Drug manufacturers and distributors will now be required to report spikes in sales or changes in distribution patterns. That's on top of already existing regulations about reporting losses and theft. The health minister says politicians aren't the ones to determine which drugs should be approved for medical use.
I believe that as health ministers, we have an opportunity to work together to make a difference in the lives of patients who legitimately need opioids to maintain a reasonable quality of life.
Provincial and territorial health ministers had asked Health Canada to delay approval of generic OxyContin when its patent runs out at the end of this month. And with me now is Global National's health specialist, Dr. Ali Zentner. Hi, Ali.
Hi.
Tell me, the idea, I think we can all agree that the idea of trying to stop addicts from using this painkiller, abusing it by crushing OxyContin, so changing to the generic form, was a noble idea, something worth doing. But should the government step in at this point and prevent a generic?
I think this government and all governments and all healthcare professionals should get behind tackling addictions in our communities. But I'm not convinced that halting a generic opioid is the way that we tackle addictions.
So you have to go deeper than that.
Absolutely. I think we need to fund addictions-based programs. We need to look at who is addicted to these medications, what opioids have people switched to, and is really this kind of switch or making a cheaper drug available really the key to addictions medicine? And the answer is absolutely not. It's a very small piece.
Did the switch to Oxy Neo and away from the crushable OxyContin make a difference when it came to addicts and abuse?
And in fact, the studies actually show not. Let's look at the data. This drug was available for 10 years, and it's really no surprise that 7 months before its patent was up, we switched to Oxy Neo. I have a hard time believing that Purdue, the company that produced it, really had these altruistic beliefs 7 months before its patent was up in a drug that was available on the market for 10 years.
And also addicts can turn to other drugs, I guess, if they're not getting the help they need to
Absolutely.
come off it.
And the studies actually show that really we didn't necessarily see a drop in addictions across the board. We just saw a shift to other opioids, for example.
And the other important point is that OxyContin is used by a lot of people legitimately for painkillers.
Hugely so. And I have to say, my belief is that for those patients who were legitimately using this for chronic pain, it offers them now a cheaper alternative to the medication. And I think the key here is making sure that from a physician prescribing perspective, we do have strict regulations and, as far as distribution and prescriptions go. And that's where you can regulate the medication, not in terms of generic versus an actual higher cost alternative.
Okay, Ali, thanks.
Thank you.